Hey guys, today I'm at b.YOU Beauty Bar in Atlanta, Georgia. I'm sitting down with Dr. Shivani. We're talking all about anti-aging and Botox. Gentlemen, I'm here with Dr. Shivani of b.YOU Beauty Bar, and we're talking today about men's anti-aging, more specifically Botox. So men are starting to take care of themselves like never before. Anti-aging is huge. It's a buzzword. Everybody's trying to prevent and fight the signs of aging. So what is Botox exactly?
Botox is a natural toxin that's produced by a bacteria, and it, when it's injected, it goes in and binds and prevents acetylcholine from being released. So it prevents the muscles from contracting.
Is it safe?
It is safe. It's been in clinical use for over 20 years. It's generally very safe and very effective when administered by a professional.
What should somebody look for in a professional, and what questions should they ask?
I think it's important that they have had, long-term experience in administering Botox. I think that you also, as a male, you do want to make sure that they've had experience doing Botox for men. I really do think that there is an art to administering Botox where the physician really needs to make sure that they understand what the expectations of the client are and what they're looking to achieve.
All right, so what can Botox do, all right, to a face as far as anti-aging is concerned? For a guy, what would you say would be some common areas of the face that men would have treated in order to look better?
So the most common areas that we treat in men are can be broken down into 3 zones. The first is the eyebrow complex, where oftentimes 2 lines develop in the forehead area. We call them the 11s.
How are mine?
They are present. For a lot of men, that's an area that they like to have treated.
Zone 2.
Zone 2 is the forehead area. So the area above the eyebrow complex, up in the forehead area.
Like the lines, mine?
The longitude, the horizontal lines that develop there.
So I'm a Botox dream come true. Like, I'm ready. Okay, and where's the third area?
The third is in the periorbital area around the eyes, where typically those lines are referred to as crow's feet.
Not referred. That's what I know them as. All right, so Doc, here's the concern that I have and a lot of men have. You see people out there that have had work done. You don't know exactly what they've had, but their face just doesn't look right. My concern as a guy is that if I were to have Botox, or maybe my crow's feet reduced, or the 11s, or my forehead, that my face wouldn't respond the same, or it just would look like I had something done. And so, what do you say to that?
Well, that kind of goes back to what I said before, that there really is an art to administering Botox. And my personal philosophy is less is more. So I think that dosing the Botox and administering it in a conservative fashion so that you maintain a natural look for the client as opposed to freezing them is a lot more desirable.
Desirable would be an understatement. So somebody gets Botox, how long does it last?
An average of 4 months.
Okay, and is it immediate? Like,
no.
You inject me and I walk out of here and crow's feet are gone?
No, actually it takes time for the medication to get into the muscle itself, and so really the peak effect is somewhere between 10 and 14 days after administration. So
will you notice anything when you leave it, or is it?
You may. I mean, I've had clients say at times,
I look amazing when and it's sort of the placebo effect.
Right. But truthfully, I don't think you're going to see much before the 3rd or 4th day. So if you have an event, it's not. You don't want to come in the day of your event and say, well, I would like to have Botox today because I have an event tonight. It would be best to come in 7
You got a high school reunion. It's in 4 weeks. That's the time when you need to start thinking. When you send that RSVP, all right, so somebody wants to have Botox done. Is there anything they need to do in prepping or getting ready to actually have the procedure done?
I think an important thing to remember is not to take non-steroidal anti-inflammatory medication.
Advil, Motrin, Aleve, all of those things other than Tylenol are NSAIDs.
Exactly.
Why?
if you have those in your system, it can increase your risk of bruising when you're having the Botox administered.
So you don't want people to know, don't take Advil or NSAIDs prior because you're gonna bruise up. And where will you bruise? At the injection sites?
Yes. Secondly, with working out, you know, whether you realize it or not, when you're working out, your facial muscles are also being utilized. And by working out after you have Botox, it can affect your results. And so to get the best results possible and to have them be as consistent as possible with your expectations, you really want to lay off working out for 48 hours after you've had Botox.
Can you make me look 25?
And then thirdly, wait, we're not done. The third, which most people don't like, is no alcohol for 48 hours.
Okay.
Which again can increase your risk of bruising.
Does Botox hurt? Because I am a big wimp. I don't like things that are painful.
You know, we use the tiniest needles. I can honestly tell you that I've had patients that are fairly afraid of needles, and they have felt that it really wasn't that bad.
How long does it last?
On average, it lasts somewhere between 3 and 6 months. But men do have stronger facial muscles than women do, and so I would say that men will most likely come back somewhere between 3 and 4 months.
Now, is it a gradual reduction, or is it just boom, one day you're like, oh, my crow's feet are back?
No, it's a gradual reduction, and what happens with time, as you inject Botox into different areas, the muscle, just like if you don't do biceps curls, your bicep atrophies. The same effect occurs with your facial musculature.
So essentially, with continued Botox treatments, you actually will need less over time because your muscles, because they're not working like your biceps, and that is the perfect analogy, they atrophy. So the crow's feet won't quite be so deep. The lines in your forehead won't be so pronounced. So it's not permanent, but it is, even without the Botox, going to make you appear more refreshed, younger, and less wrinkled.
When I've had patients come in and have Botox for the first time, sometimes I see them usually 2 weeks after their treatment, and they'll say, you know, my friends just can't put their finger on it, but they say I look refreshed, or they've asked me what I'm doing with my skin. So you can tell them you have a new cream. You don't have to, nobody needs to know what you're doing.
Gentlemen, I think that is the perfect answer. Somebody's gonna know, they'll be like, you look fantastic. Be like, oh really? Lie, is what you're saying.
No, I'm not saying lie.
When somebody accuses you of looking refreshed, you say, yeah, I got a great night's sleep, I started exercising, but you don't say you had Botox, right? That's what you're saying.
It's up to you.
From a professional. All right, so another concern is cost. How much does it cost? Is there an industry average? Is it between X and Z?
Well, there's two ways that people charge for Botox. One is by the unit, and the second is by the area.
Okay.
I think to be fair to the consumer, my personal feeling is it's more fair to charge by the unit, because then you're only charging the individual for the amount of medication that you're using versus saying a global number for an area, which if somebody has a small forehead, you may not be using anywhere near that number of units. So an industry average per unit would be somewhere between, I would say $12 to $15 per unit.
Per unit, okay. But here's the thing, you gotta be careful about where you're going, because some places that you go to have Botox done will actually dilute the Botox. So it's not as strong, it goes further, but they're charging less. So like, oh, it's only $3 a unit. Well, it's diluted and you're gonna require a lot more, correct?
Correct. It also will not last as long.
Doctor, thank you so much for taking your time to talk to us. Gentlemen, we're here with Dr. Shivani at b.YOU Blow Dry and Beauty Bar. If you're ever in the Atlanta area and you'd like to come by and get a little anti-aging, have somebody professional that's going to have that light touch that's not going to make y'all look frozen and crazy, which is not good, right? You won't do that, right?
I don't like it.
There's a link below. Contact her, ask her questions. You can come, she'll talk to you, she'll treat you, she'll make you look like $1,000,000. I'm telling you, and while you're here, you might as well bring your wife or girlfriend, because they also style hair and do blowouts. It's really a super cool place. Totally comfortable, and it's just been awesome. Doctor, thank you so much. I learned so much. See, I'm not even scared of it now. Gentlemen, I hope you learned something. Thank you. Later.